Hello, this is Dr. Aragón, and together with my colleague, Dr. Carolina Valdivia, we operate the website glaucomaeyeinfo.com. Today I'm going to talk about the drug Latisse. Now, for those of you who don't know, Latisse is a product that can lengthen, can thicken, and darken your eyelashes. And during the past year, we have had a steady stream of women and some men come into our office asking about this product, whether it's right for them, and most importantly, whether it's safe to use. And so that's what I'm going to talk about today. The safety of medications in the United States is determined and overseen by the Food and Drug Administration, or the FDA. And actually a number of other countries throughout the world use the FDA's stringent standards as well. Now, the FDA has determined that Latisse is safe if used as directed, with the caveat that it may cause mild to severe side effects in some people. And for this reason, it's important that if you're taking any drug, not just Latisse, but any medication, that you monitor your reaction to that medication closely and report any side effects to your physician, no matter how trivial those side effects might seem to you at the time. Well, now that we understand how the safety of medicines is determined, let's address the product Latisse. On December 5th, 2008, the pharmaceutical company Aragón received approval from the FDA to market bimatoprost ophthalmic solution under the trade name Latisse. Now, bimatoprost ophthalmic solution originally was approved by the FDA for treatment of glaucoma and ocular hypertension. That's pressure inside your eye, and under the trade name Lumigan. But ophthalmologists prescribing this medication, and I noticed it myself, so did Dr. Valdivia, that it appeared to be promoting the growth of longer and fuller and darker eyelashes in our patients. Now, as I said, clinical trials have demonstrated that Latisse is safe when used as directed at the recommended dosage. However, those that are thinking about using the drug should be aware of its potential side effects. Now, the first of these is a darkening of the iris portion of the eye. That's the colored part. And ophthalmologists noticed this as they were prescribing this as a prescription for glaucoma, that their patients who had hazel or blue eyes tended to develop brown undertones. So the blue became darker, the hazel became brown. People with brown eyes developed a much deeper brown eyes. Now, this doesn't happen to everybody, but it happens to enough people that it's something to think about. And while this obviously would be a reasonable trade-off for someone with glaucoma when weighed against the prospect of becoming blind, changes in your iris color might not be something that you would want to have happen, or you would not want to have the risk of it happening. Now, Latisse is applied to the upper eyelid margins at the base of the eyelashes, and under no circumstances should it be applied to the lower lashes. And the reason why is because of some other side effects associated with the medicine as well. One of these is that Latisse can cause a darkening of the skin on the upper eyelid. And while makeup can effectively cover and blend blotchiness or what have you in color on the upper eyelid, changes in the lower eyelid color would certainly not be aesthetically desirable. And this is because the darkening will occur in this area, actually below the eyelid, and that's already an area that is subject to darkening for other reasons. However, the skin darkening appears to be reversible if the medicine is stopped, whereas the iris darkening is not reversible when the medicine is stopped. Latisse also has been reported to induce hair growth on the face in areas where a drop of the drug might have inadvertently fell. And this makes sense since it induces hair growth in the lash area. So, again, this is not a problem for the upper eyelid, because when you apply it there, gravity will tend to pull it down to the lashes, not up to the eyelid. So you really don't have to worry a lot about excess hair growth in other areas. But on the lower lid, something else happens. If you apply it there, it's going to tend to bleed down into the area under the eye, and you may start to grow hair there. And so that definitely would not be aesthetically pleasing and is, something you want to avoid. Now, if you're using Latisse, applying the regular dosage to the upper eyelid will transfer some of the drug, not much, but some, in a sufficient amount, to generate some growth on the lower eyelid as well. And it will do it only across the lash line, because the transfer happens through blinking. Other potential side effects associated with Latisse include blurred vision after it's been applied, eyelid redness following application, eye discomfort, it could be itchiness or other things like that, a temporary burning sensation during use, an infection. This is a very important one. If the one-time applicators that come with Latisse are reused, you're not supposed to reuse them. And if you do reuse them, you're putting yourself at risk for an infection in the eye, so please don't do that. And then finally, your lashes might grow so long that they become ingrown, and in that case can scratch the cornea, the front part here of the eye. And we definitely don't want that to happen, and that's why the drug has to be used under a doctor's supervision. Now, the medicine is expensive, costing an average of about $120 for a 1-month prescription, and it will take a minimum of 2 months for you to really see full results. Now, the same drug sold as a glaucoma drug costs about half as much, and some physicians have been prescribing this to their patients so that they could save money. I don't recommend this because it raises the possibility for side effects, because patients then have to look for other means to apply the medication, because the ophthalmic solution, which is used for glaucoma, doesn't come with these applicators. And so you risk infection, you can risk more discoloration, you can risk applying too much, all of that. I personally cannot recommend using any product in and around your eyes that has not passed through the extensive testing that is required for FDA approval. And the reason for this is that medications failing to meet these standards can have questionable purity, sterility, and consistency. They may also contain additives that can cause undesirable side effects as well. For example, corticosteroid additives, which many times are used because they reduce inflammation, potentially can cause cataracts and elevations in intraocular pressure. That's the pressure inside your eye, and this can lead to glaucoma. So in summary, Latisse has been determined by the FDA as safe and effective if it is used as directed, but it can have some undesirable side effects in some people. So I hope that this information has helped you in making your decision if you want to use this drug. For more information about eye care and eye disease, I invite you to come to glaucomaeyeinfo.com, where we have information on a number of issues associated with eye health. Thank you very much.